How do you know whether you have a prolapse? Many of my clients will come in and say, Kirsten, something doesn't feel quite right, and my friend came to see you and you diagnosed her with a prolapse. I'd like to know whether I have a prolapse. Well, some of the more common symptoms are heaviness. So you feel a heaviness in the vagina, a dragging sensation, like something's being pulled down that never used to be there. Or if you have a cough or a sneeze, especially with a cough, you feel this like trampoline-like effect, like you feel this wah wah of the tissues stretching and going up and down. Or you might feel like there's actually something sitting in your vagina. So when you sit down, you can feel like you have to kind of move around a little bit because it feels like there's a bulge or an egg or like a tampon that's not quite sitting quite right in the vagina. And also, you could have urgency. So that's where you feel like you have to go pee all the time. That's quite a common sign of bladder prolapse, but also for other things too, like a tight pelvic floor. And sometimes the symptoms of different conditions, they overlap. So I did a video earlier about whether you know whether you have a tight pelvic floor. And some of those signs and symptoms are very similar to a prolapse. Now, you may also have low back pain, so a drawing, aching, usually towards the sacrum, like just where the sacrum and the low back meet. Or you may have lower abdominal discomfort, so you feel like a heaviness right in the lower abdominal around the pubic bone into the groin area. So there's also, because it's those ligaments that are being stretched down a little bit, and you have that, like I said, that dragging sensation. You may also have what's called post-micturition dribble, but pretty much you go sit on the toilet, you have a pee, and you think, yeah, I'm done. And then you get up, and then it goes drip, 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 drip as soon as you take the first few steps. And that sometimes is because our bladder is not sitting correctly, but also could be because you didn't spend enough time on the toilet, you didn't allow yourself to finish voiding, or maybe you don't have a very strong pelvic floor, and we have to manage that too. So if you do have a prolapse, the answer is not just to do a whole bunch of Kegels. I just saw something about a Kegel chair and that it does like automatic Kegels for you, 17,000 in half an hour or something. Okay, no, that's not what you want to do. You want to be assessed and see, hey, do I have a prolapse? Do I have maybe a tight pelvic floor, a pretty good pelvic floor, or maybe a lower tone pelvic floor that really needs lots of help to kind of get it going and get it stronger again? Do I have maybe some nerve damage, or do I have other areas that have prolapse, not just the one bladder prolapse? Maybe I have a rectal prolapse. Maybe I have the uterus has fallen down. So it's or the apical prolapse where the vagina is fallen down after a hysterectomy. So let's review. Heaviness, number 1. Bulge in the vagina, number 2. Urgency, quite common. Dragging sensation in the vagina or even in the lower abdomen and into the low back. That after you void, you dribble quite a lot. You don't feel like you can finish. And most importantly, you might actually feel something coming out of your vagina. Okay, so it may be towards a grade 3 prolapse where you feel you actually have to push something back in again. Well, pretty well you're going to be having a prolapse if you have to push something back in again. So if you have those signs or those symptoms, make sure you go talk to someone, go talk to a healthcare provider, and they can kind of direct you maybe to a pelvic floor therapist if it's not I was going to say terrible prolapse, but pretty much a lot of people say, Kirsten, it's always terrible. But if you have a lower grade prolapse, maybe like a 1+ or a 2-, when we do proper pelvic floor therapy and get that pelvic floor working again, we can really minimize the symptoms of prolapse. But if you have a prolapse, say a grade 3, where you have to push you feel like you have to push tissue back into your vagina, well then definitely you're going to be heading down to the OBGYN route to talk to them, discuss your options. Is it going to be like a pessary or is it going to be surgery? And see kind of where your options are. And some women, many women, they don't want to do surgery. They'd rather do a pessary or they'd rather go see a pelvic floor therapist and try to do conservative care. So I hope that explains whether you have a prolapse and what your symptoms might be. And do try and seek help, because you may find that actually your symptoms are very much eradicated or improved if you do the right thing for your pelvic floor. Okay, well, I hope that helps and have a great day.